Hi everybody, I hope you're doing well. It's been a while since I've done one of these videos and I apologize for that. There's a lot of travel this summer and we couldn't squeeze those in, so this one will be a little bit long. We've got lots of great information to share with you. In fact, it's probably so much information that I'm going to do another short video to talk about all the great shout outs and the awards and the acknowledgments that so many of you have received. And so we'll do a little different this month. We'll do two videos. So first of all, I want to start in our traditional fashion with some wins. It's always such a pleasure to hear from our patients about the great care that you provide. It says, just a note to share my experience as a patient at your hospital. I was admitted on Thursday the 15th and discharged on the 18th. No one likes to be in the hospital, but the doctors, nurses, and staff were so professional and kind during my visit that my stay was made bearable. Well done in your choice of employees. I'm sure you are very proud. I'm on my way to recovery thanks to your crew. Isn't that awesome? And then this one says, due to a fall, I dislocated my shoulder, had ligament damage, broken bone, and other damage to my shoulder. I had to have surgery to fix all the problems. I was in a shoulder sling for 4 weeks after surgery and then continued physical therapy for 4 more weeks. After 8 weeks, my shoulder had not felt better. Dr. Jameson and his staff were excellent. I live 2.5 hours from Stillwater. On all my doctor's visits, Dr. Jameson has never had me wait. I was seen before or right at my scheduled time. I have never had to wait. I've never had such a pleasant experience with a doctor or staff. They are excellent and professional. I would highly recommend Dr. Jameson and the Ortho Oklahoma of Stillwater. The people in the Stillwater surgery facility were also professional and I was treated excellent. I hope I don't have to go through this again, but if I do, I will gladly drive the 2.5 hours to Stillwater and Ortho Oklahoma. Thanks to Dr. Jameson and the entire team at Stillwater Medical. And it says, another story from a patient that had to drive. It says, I just wanted to tell you that I'm so thankful for the excellent care I received in the ER. Every single staff member I saw was friendly, kind, and resourceful. From my RN Elise to Dr. Fisher, to the LPN who placed my IV, and even the ultrasound tech who did my ultrasound. There is no such thing as a good miscarriage experience, but they literally made it as comfortable and smooth as it could have possibly been. Thank you for striving so hard to provide good care. It was worth driving from Ponca City, even though the ride was unpleasant to say the least. It's pretty remarkable that someone would write that letter after, as we know, there is no good miscarriage situation. So thank you so much for all you do. It really makes such a difference in the lives of others. So with that, we are happy to report we have installed our new MRI. We should begin seeing patients the first week of September, and several people have done test images and they've kind of described it as spa-like, which is kind of cool. I never thought we would be able to have an MRI experience that's spa-like, so really excited about that new technology. I was so excited to kind of get rid of Tent City in the back, but we may need to move our PET CT back to that same area once the MRI is up until we get the PET CT installed over at our new cancer clinic. So it might stay around for a while. We hosted our chamber after hours recently, and we highlighted our new occupational and urgent care clinic on the north side of town. Hopefully some of you had the chance to see it. It is really great space, and that team over there is just tremendous. So, I think we're hearing lots of positive comments. So congratulations to that team for that great event. Our board approved new cardiac monitors for our new Heart and Vascular Institute and our ICU, so those will be coming soon. They also approved new fetal monitors for our maternal child health unit, and those monitors come with a new twist, a new development that our patients, while being monitored, will be much more able to get up and about, take a shower, not be right now they have about a 3-4 foot span, and so that'll be a great enhancement for our patients. We have a team that's been working on dementia patient care improvement, which is so important, and so they're putting together care plans and education and working with some of our community partners in town, the adult daycare center, and so excited about that team and thankful to all of you that are working on that. Some new news that I think will be beneficial to some of our patients is we have a new medical legal partnership that's going to be beginning. It's through the Legal Aid Society of Oklahoma. Stillwater Medical is going to be providing some space, and they're going to be providing the attorney. They'll be located on site here at Stillwater Medical. And so for our patients that might find themselves in vulnerable situations that don't have the means to get out of, for example, if they're living in a rent house that the conditions are not safe and the landlord's not willing to fix them, we could use this attorney on site to help them through some of those dangerous social situations. So excited about that. That should come in the next couple months. So honored and thankful for our volunteers. They recently held a silent auction for mobile meals and raised over $3,500 for our mobile meals program. So thanks to all their efforts and thanks to all of you that contributed. We have lots of new physicians and providers to share with you. Drs. Wanch and a physician's assistant, Kendall Weeder, have joined Stillwater Surgical Associates. Our 2 new urologists have hit the ground running. Dr. Rademacher and Dr. Shaw have joined Dr. Lovitz down at 12th Street. We've added 2 new members to our Cushing team of physicians and providers, Molly Tanner and Jamie Griffith. We also have our psychiatrist that's signed a contract and will be joining us next summer, Dr. Andrew Waller. We have a new pediatrician, the same story, has signed a contract and will be joining us next summer. Her name's Dr. Hutchinson. And then hot off the press, we have a cardiologist that has signed and will be joining us in November, Dr. Catherine Farguson. Lots of construction news to update you on as well. Our Heart and Vascular Institute project, that's on track to be finished towards the end of November. So excited to get that wrapped up and hopefully free up some parking and open in sometime November. Our site and canopy, the next spot they'll move is to the east canopy by our medical office building. You'll begin to see some work on that in the next month or so. We're going to have to close down that entrance at some point and put in some temporary entrances on either side of that canopy to be able to access both the medical office building as well as the hospital. And then there'll also be a staff pathway, if you will, on the back side of the hospital, on the south side of the hospital, to get between those 2 buildings. The board approved last night that we can move forward on our new surgical suite expansion and renovation here on the main campus. Excited about that. That will allow us to update all of our OR suites as well as add OR suites, and additionally on the 2nd floor create a new women's center and connect our medical office building to the main building on that 2nd floor. The board also approved a pharmacy remodel. They'll still stay in the basement, but they'll be moving right across the hall, kind of across from the elevators. And so the planning is underway and work will begin soon on that. Surgery center, we've got to make more space out there for all the GI procedures they're doing, and so there is a team working on that space and getting it planned so we can get that out to bid, and we plan to get that out to bid later this year. And then congratulations to all of you. We got word back from CMS on our value-based purchasing scores. That's where they take money away from hospitals and physicians, and then they score you, and if you score better than everybody else, you get the money that they took from you and a little bit more. If you score poorly, you don't get all the money that they took back from you. It's a zero-sum game for Medicare, and so congratulations to all of you. We are scoring better than others, and so we're getting what they took from us and a little bit back, so that's really exciting news. And then also our accountable care organization, thank you to all of you working on that. We scored 100 out of 100 on our quality score, so a perfect score, so very impressive work. And then last but not least, you've likely heard about State Question 802, which is Medicaid expansion. I just want to share the facts with you around that state question. If our state expands Medicaid and passes that question, it would mean an additional 200,000 lives covered by insurance. So these are people that tend to be working, they just don't make enough to qualify for Medicaid coverage, and this would lower that threshold to where more people would be able to qualify for Medicaid coverage, which could help expand coverage in our state. We currently these are taxes that we're paying at a federal level that are taken from us already, and other states that have expanded Medicaid get to reap the benefits of these dollars, and so this would bring in about $1 billion into our state. It would help rural hospitals by expanding that coverage to more Oklahomans to have insurance, as we know is so expensive. So with that, I hope you guys are doing well, and thank you for all you do. You're such a great team, and hope to see you soon. Take care. Bye-bye.